my name is Emma. I'm going to be a nurse practitioner today. Can I have your full name and date of birth?
Yep, it's Jack Melvin. I was born April 2nd, 2002.
All right, and today we'll be doing a head, ears, eyes, nose, and throat exam. Do I have your consent for this?
Yep.
All right. Let me start by washing my hands over here. You're in the proper sitting right here position, and we have adequate lighting for our exam. I'm going to start with the skull. Right now I'm inspecting size, symmetry, lesions, any lumps, along with your hair distribution. Next, I'm going to palpate now. I'm going to palpate for any abnormalities, masses, deformities, and any tenderness. Do you have any pain when I do this?
Mm-mm.
All right. Okay. Now I'll be visualizing your face for facial symmetry, as well as any facial expressions or tics that you may have throughout this exam. I'm now going to palpate your temporal artery. I'm going to be looking for thickness and tenderness. Any pain when I push down over here?
Mm-mm.
All right. Now I'll be palpating your temporomandibular joint. I'll be looking for crepitus, any popping or cracking underneath the skin, range of motion, as well as any tenderness as you open and close your mouth. Open and close and open and close. Did that hurt at all?
No.
All right, so no crepitus, no tenderness, and you have full range of motion. We're gonna move down to the eyes now. Right now, I'm visualizing and inspecting the outer parts of your eyes. I'm looking at your lids, your lashes, your sclera is a nice white color, your conjunctiva. I don't see any drainage, any redness. I'm gonna have you take off your glasses real quick. I'm gonna visualize your lacrimal apparatus. I'm gonna push down on the skin and pull it down. I'm gonna have you look up, just so I can visualize. Look up, please. Thank you. All right. Okay. I'll have you put your glasses back on because we're gonna be getting into a visual acuity test, the Snellen eye chart. Snellen eye chart is used to test for visual acuity, especially when people have glasses. They should wear it just to make sure that their lenses are corrective for this test.
Mm-hmm.
For this specific form, we'll be doing 6 feet. I will have you cover one eye, read the lowest letters that you can read, and then I'll have you repeat it with the other eye. Okay?
All right.
So I'll have you cover your right eye first. I'll have you read the lowest line that you can do.
LTFPH.
Okay, and then I'll have you, cover the other eye, and then I'll have you read right to left.
HPFTL.
All right, and then both eyes together, you can read left to right.
LTFPH.
All right, thank you. I only have you read right to left the second time because a lot of people feel like they're memorizing letters instead of visualizing it.
Mm-hmm.
Okay. Next, I will be testing for oculomotor cranial nerves 3, 4, and 6, ocular motor, trochlear, and abducens. So first, I will be using my pen light. I'll have you take off your glasses again.
Mm-hmm.
I will be visualizing your pupillary constriction with light and accommodation. So first I'm going to shine a light at you in your pupils, and I will be looking for constriction. I'll just have you look straight at me. All right. Pupillary constriction noted. Pupillary constriction noted. Now we'll be testing for accommodation. So as this pupil constricts, this one will constrict as well. All right. Accommodations noted. Accommodations noted. So your pupils are equal, round, reactive to light, and accommodation. Okay. Next, we'll be testing your extraocular movements. So I will have you put your glasses back on. All right. So I will have you look at me,
Mm-hmm.
and I will have you follow your eyes with my pen light. I'll be doing the 6 cardinal fields of gaze,
All right.
just to test, moving your pupils and eyes. So I'll have you just look at me, follow your pupils with the tip of this pen light. Okay? All right. Any double vision?
Mm-mm.
Okay. Your eyes are moving swiftly. Good. Your eyes move swiftly. There was no strabismus, no nystagmus. Noted no diplopia, so your eyes are very healthy, moving around. Your cranial nerves are intact, 3, 4, and 6. So now I will do a visual field. I'll just be testing your perceptual vision. So I'll have you look at me. I'm going to put my hands out and wiggle my fingers. and I will just have you let me know when you can see my fingers wiggling. If you can't, I'll just have to bring them a little bit closer. This is just testing your visual field using confrontation.
Alright. Yep.
Okay, we'll do the same with the other side.
Yep.
Alright, now we'll get right into your fundoscope exam. I'll have you take off your glasses. Okay, so I'll be visualizing the inner parts of your eyes. I'm going to use my right eye to visualize and inspect your right eye, and then I'll use my left eye for your left eye. Okay? So you're going to feel a shining bright light into your pupil, and then I'm just going to visualize the inner parts of your eye, and then I'll take it away. Okay? You ready?
Yep.
I'll just have you visualize at the doorknob and keep your eyes staring at the doorknob.
Yep.
All right. Visualizing the red light reflex. I visualize the optic optic disc, the vessels, the retina, and the macula. Your vessels look very healthy. I'll do it on the same eye, the next eye. My left eye with your left eye, okay?
Mm-hmm.
All right, visualizing the red light reflex. Okay, looking at the optic disc, the vessels, the retina, and the macula. All right, so that completes our eye exam. We'll have you put your glasses on, yep. We will move to the ears now. Okay, so now I will be visualizing the outer parts of your ears. I'm looking at alignment. They're aligned, they're symmetric. I'm looking at the outer parts, no redness, no discharge, no lesions, no lumps. Before I begin to do my inner part of the exam for your ears, I will palpate your pinna. Okay, any pain?
No.
Palpate your tragus.
No.
And then your mastoid process. Any pain?
No.
All right. Sometimes people with painful palpation to the pinna, it might let you know that they have a ear infection. So I'm glad you don't have any pain. I will now examine your ears. Okay. All right. I am looking for canal patency, cerumen. I see your tympanic membrane's a nice pearly white pink color. It's not red, it's not bulging, there's no fluid. Okay, I will do the other ear. Alright, I'm looking at your canal patency, cerumen, tympanic membrane. A nice healthy color again. Okay. I'll be testing cranial nerve 8 now, your vestibular cochlear. This is the hearing portion. So first, I will be occluding one part of your ear, and I will be whispering a 2-syllable word into one of your other ear, and I'll have you repeat it back to me, and then we'll just repeat it with the other ear, okay?
Alright.
So first I'll occlude this ear, and then I'll whisper a 2-syllable word.
Apple.
Very good, the word was apple.
Baseball.
Okay, good. We're gonna get right into the Weber test now. So basically I'm gonna strike the tuning fork against my palm, put it in the center of your forehead. It's gonna be testing for conduction. I want you to let me know if you hear air traveling more in the sound of your left ear, your right ear, or both. All right, so I'm gonna strike the tuning fork. One second, sorry.
The middle. Both.
Okay. All right, I will strike it one more time. We are going to do the rhyme test. I'm going to put it on a bony prominence behind your ear, and then I will also ask you when you no longer hear that noise, and then I will place it right in front of your ear, and I'll ask you to tell me if you can still hear it, okay?
Yep.
So let's do this. Okay.
No.
Still hear?
Yep.
All right, very good. That's because bone conduction is a lot less weaker than air conduction, and that's still why you hear it. Okay?
Mm-hmm.
All right, we will get down to the nose. I'm looking for any deformities, lesions on the nose, any discharge abnormalities. I'm looking at your septum. Okay, first we'll do a nasal patency test. I'll have you occlude one of your nostrils and breathe in and out with the opposite, and I'll have you repeat it. Okay. All right, very good. Now I will be visualizing the inside of your nostrils. Okay, I am looking at the mucosa. Nice healthy pink, no discharge, no polyps, no bleeding in there. Again, a nice healthy pink mucosa, no polyps, no discharge. All right. Before we move on to the throat, I'm going to palpate your I'm going to palpate your frontal and maxillary sinuses. Any pain?
No.
Okay. And then any pain?
No.
Okay. And then I realized before we move on to the next, I'm just going to test the other ear with bone conduction with the Rhine test again, okay?
Alright.
So I'm just going to do the same, strike the tuning fork, feel in the back of the bony prominence, and then I'll ask you again with this ear, okay?
Mm-hmm.
All right, so let me strike it.
Gone.
Okay, you still here?
Yep.
All right, good. So both ears matching, the bone conduction is less strong than the air conduction, okay? All right, and as to your nose, we already did the nasal patency. I looked inside, healthy nose, and your sinuses feel healthy, and there was no tenderness to palpation, so that's good. We can start moving on to the throat, okay?
Perfect.
All right, so the throat, I'm looking at the outer parts of your mouth right now. No lesions, no lumps, no redness. I'm gonna have you open up your mouth so I can visualize. I'm looking for erythema. Okay, nope. I'm looking for any exudate. I'm visualizing the posterior pharynx and your uvula, okay? I will be testing cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve, or vagus testing. So basically, the glossopharyngeal is more, I'm gonna have you open up your mouth, you're gonna say ah. I'm gonna visualize your uvula rise and your palate symmetrically rise too. And then your vagus nerve will be your gag reflex. So I'm just gonna go ahead and test that.
Alright.
And have you open up your mouth, say ah, uvula rising, the palate is symmetric, gag reflex. All right, thank you. Okay, and then I'm also going to test cranial nerve 12. That is going to be the strength of your tongue, and that is the hypoglossal. So basically, I'm going to have you take your tongue and push it out against your cheek, against the force of my palm of my hand. Push out. Thank you. Push out. All right. And before we get to the lymph nodes, I'm just going to palpate the inner parts of your mouth. Make sure there's no lumps in there, ulcers.
Alright.
I'm going to have you open up, lift up your tongue. Okay. Any pain?
Mm-mm.
All right, and I'm just going to do your palate. Any pain?
Mm-mm.
Okay. All right. Just going to wash my hands real quick, and then we'll get to the lymph node portion. Okay. So right now, I'm palpating your submental, submandibular, tonsillar, preauricular, postauricular, anterior cervical, posterior cervical, supraclavicular. And right now I'm just feeling for any nodules, lumps, tenderness, any pain in it as I palpate.
Mm-mm.
Okay, the occipital. All right. And then the last, I'll just palpate your thyroid. I'm looking at the size. I'm checking for tenderness. I'm feeling for any lumps or nodules. I'm going to have you swallow. Okay. All right. Any pain as I palpate this?
Mm-mm.
All right. It was very nice to meet you. This concludes our exam. So I'll see you in the next checkup.
Sounds good. Thank you.
Thank you.